the wonderful panel. I wish we had more time because this discussion needs lot more time. Moving on, I think we have a next an invited talk by Mr. Dileep Mangsuli. It's my pleasure to introduce you, sir. He leads initiative at Siemens Healthineers aimed at improving healthcare access in underserved regions. Because I want to bring in strongly, very strongly bring in the angle of public health also here. His work encompasses innovations in artificial intelligence, digital twins, and immersive technologies to advance diagnostic precision and patient care. He also chairs the American Oncology Institute and is a senior VP at Siemens Healthineers. Over to you, sir.
Good afternoon. After lunch, always it's like a diesel engine. It takes time to build up speed and build up audience. I think I'm in the middle path. So I think there's enough speed at least that has been picked up. Sudha left last statement before closing her panel discussion. She said, building a healthy India is one of the biggest goals, healthy India. And how do we look at managing health and not disease? And I want to give a small example of how this worked in China. I lived in China for 3 years between 2004 and 7. And I had a chance to really closely look at how healthcare system works. And one of the very interesting systems that they have is not everyone has it, but many of the people in rich class use is something called as a family doctor in China. They use them on an annual retentionship basis. So annually they are paid for managing the family health a certain amount of money. But the catch is, if someone falls ill in the family, there is a deduction. And more family members fall sick, more deduction in the fees that the doctor gets. So that means he is incentivized in keeping the family healthy, not in treating diseases. So rewards decide the behavior everywhere. I think if the behavior needs to be changed, the rewards, the way you reward people needs to be changed. If people are rewarded because you are treating a big disease, they will always try to treat a big disease. But if you are asking them to keep a healthy person healthy, then it's a very different approach. I want to bring in an aspect of how this is changing with the technology. And at Siemens Healthineers, we are looking at it in a very different way. If you think about what's happening globally, the population is increasing tremendously. I think by 2030 or 2050, our population is going to touch nearly 10 billion across the world. And half the population is still having a challenge of access to healthcare. It's not about having hospital, but not having access. I had recently a very close friend of mine who was in Bangalore, but he could not get medication and care in time during the midnight when he had a heart attack, and he could not be taken to hospital because even an ambulance did not reach him in time, and he was lost. We lost him to heart disease. A very young man, a colonel, one who looked fittest. And a similar case that had happened in our office in Siemens Healthineers in Electronic City, where a person complained of chest pain. And we could move him within 7 minutes to a hospital where he could be, revived, and he recovered with a stent placement and he survived. And today he's leading a healthy life. So think about the challenges. What it really talks about is where you live should not decide if you live. And this is the case in most of the places. If you are living in some places, you probably don't have a right to live when you really fall sick. I think that should change worldwide. And this is a problem with many countries. I had a chance to travel in Philippines, and for anyone to really get some kind of medical help, they had to travel 100 kilometers by boat, even to reach a primary healthcare center. And those are challenging situations. So I talked about changing population, but also there is another big challenge is about changing number of deficiency in terms of skill set. Health skill across the world is going to be nearly 18 million shortage by 2030. I mean, that's a scary thought. With present number of people itself, we are really struggling. And if this continues to grow, this is going to really create a huge challenge. And what is changing, fortunately for us, is the technology is changing. The computational power of our devices is exponentially growing. So is internet speed. And these are something that are going to change the way we look at health in the future. I wanted to show you this particular example of X-rays. Globally today, nearly 3.6 billion X-rays are taken every year. 3.6 billion X-rays. And of that, nearly 74% of the X-rays are normal. They don't have any actionable diseases, non-actionable diseases. So that means you have to be not worried about those things. But imagine a radiologist, a clinician, looking at every one of these reports will be spending 74% more time. What he should be spending time is on those 26% of the cases where there are really challenges. And this is something that is changing. And today, fortunately, in India also, we have a lot of diagnostic centers who have deployed one or other way of picking these non-actionable diseases, bringing normalcy into a separate group and non-normal X-rays or CT scans or MRIs into a separate group so that one can address the right kind of issues. Can you tell me what is this? This looks like a galaxy. But this is actually a data of one single cancer patient in one hospital, where each node represents a department or a clinician or function, whoever is working on a patient data, and how the patient data moves from one department to another department or one person to another person. This data has been mapped by one German university with which we are working on really looking at how do we address cancer patients across the world. And this tells you the complexity of the data and complexity of decision making. And this is where, human beings cannot be able to really manage this kind of a data. And ability to really come with decisions become very challenging. I'm a chairman of 18 hospitals which actually manage cancer patients across the country. We treat nearly 130,000 cancer patients every year. And for us, it is a huge challenge to look at every patient data and how do we bring in expertise and how do we create insights about each patient in every hospital with the same precision becomes very challenging. And that's what we are trying to do with data and how do we really use data to really bring the outcome. This is one great example that is changing in the country right now. TB, all of you must be knowing that this is one of the oldest diseases. I was actually born in a hospital campus. My father worked in a hospital, and this has one of the oldest TB sanatoriums in the state and in the country, which was built in 1932. And today also, we have 11 million TB patients across the world, and 25% of those patients are in India. And the only way people could really be, diagnosed with TB was people going to a hospital, doing the X-rays, someone expert looking at it, then doing the sputum test, and you know that someone has TB. But today, with the advent of AI, this has been made possible for screening in villages. I myself travel to different villages looking at how this is done in India today, is using ultra portable X-rays which are as big as camera, And using AI, they are able to then and there decide if a person has TB. And then they go for a sputum test, and technology is making a huge change and huge difference. And this will continue, not just for TB, for other diseases as well. And other areas we are seeing a big use is, of course, in terms of training, uh, the the clinicians in terms of early planning of surgeries using VR and AR technologies, uh, using drones technologies for early delivery of samples. Even for in the future, these will be started using for even organ deployment across cities. And lastly, on remote engagement of patients or doctors, this is something that we have developed a technological solution to really create reports for not just India, but for global as well, using India as a base for technology development. Using our technology teams as well as our hospitals, we are able to really understand using AI technologies, creating the insights about scanning. To give you an example, even in UK, it takes nearly 2 to 3 months for someone to get a report on CT scan. It won't happen before that. And they are needing for an early detection of patients for a better health. And in the long run, I think one of the goal, North Star for us has been to build digital twins. Digital twins are going to be the future, where not only for planning your treatment for patients, but also for people in the long run, probably in 10 to 15 years. I can't really predict the time. It's going to be a possibility in the near future, is what I would say, where anyone who is carrying a mobile phone can use that as your own digital twin, which will be able to give you an early indication of your health deterioration, or how do you manage your health rather than manage your disease. I think that's going to be the change that we expect to make a difference. I mean, to give you one example, why we believe this is going to be a big future is look at how CT was done in 1974 and how a CT image looks today. And this is a cinematic rendering of the image that has been taken on a Siemens CT, and how detailed you can go with today's CT scans, which are called photon counting CTs, which can give you precision measurement of detailing. And that's going to be the future. And what I'm excited about is what digital health mission of India can do. I talked about in the beginning about family physician who was able to manage health of a family. That was only because he knew history of a patient. Now think about digital health mission of India. This is going to create a history of every patient, which is going to be possible for us to use it to build a futuristic predictive health management for everyone in the world. And India can be a great example, because what we proved with digital mission on financial, we can actually make a big difference in digital mission on health. That, I think, is going to be an exciting part, and we are going to be all part of it. Hopefully in our lifetime we'll see this. Thank you. Yeah.
Thank you, Mr. Dileep, for that wonderful session. I now invite Mr. T.R. Anand, Charter Member of TIE Bangalore and Chair of Matrix Forum, to give away the token of gratitude.